Thank you, everyone, for coming today. My name is Nick Anea. I am the product manager for GloCyte, and hopefully we're all here today for the GloCyte automated cell counter for CSF. Today we're going to have a little bit of fun. I'm going to walk you kind of through didactically, all the use cases of GloCyte, how to use it, how it's run, how we see certain customers run it as well. We have Jordan Lawrence, who's located back at our HQ in Norwood, Massachusetts right now. She's actually in our demo lab. She's going to walk you through the system, walk you through how to handle a specific CSF sample to show you the hands-on. And then we're just going to answer any questions. Chat, and you have a question, let us know. Do quick if you need to get something. I have a couple of people that are monitoring the chat that can help me as well. So just please, we're here to learn today. I'm excited to share this product with you guys, and I hope everyone gets a lot out of this presentation as well. So without further ado, let's get started then. So today we're going to be talking a little bit about the GloCyte automated cell counter for CSF. But before we really get started, I just want to, I know a lot of us here are clinicians, have some level of CSF, but just to level set everyone here, I want to go over the importance of CSF in general and what it's really used for, right? So in general, just a general definition of what CSF is, right? Cerebral spinal fluid. It's a fluid that bathes the brain and the spinal cord. And why is it collected, right? It could be used in a number of different ways, right? For infections like meningitis, encephalitis, to identify, a hemorrhage ultimately, to show you some malignancies like leukemia or lymphoma, or a demyelinating disease such as Guillain-Barré, right? And those clinicians in here, we often know how it's collected, lumbar puncture. I hope many people on this call haven't had to endure that. Just anecdotally, I heard it's not the funnest of procedures in general, but a lumbar puncture is a spinal tap where we collect the CSF, and it's normally collected in 4 specific tubes. But once again, level setting, CSF, what it's really used for in the clinical lab and why it is ultimately really important for the clinician or the doctor here. So timely analysis of CSF is crucial, right? The whole part with the CSF in general, the protein concentration in the CSF is really, really low compared to plasma. So cells degrade very, very rapidly. So those of you here that have collected a CSF sample or worked in a clinical lab, when you get these samples, they are stat. They need to be ran almost immediately, right? And then normally the CSF is, like I mentioned in the last slide, is collected into 4 separate, aliquots or containers in this case, right? And these vary from hospital to hospital, from clinic to clinic, but normally the first tube is used for chemistry and serology. Second one's normally used in more of the microbiology area when it comes to gram staining, those type of cultures and things like that. Common place and where the GloCyte really works with that 3rd tube is normally is for total cell count, and then 4th tube, cytology and immunology. Now, these could vary dependent on the hospitals, but this is normally the threshold that we see from lab to lab as well. So timely analysis, once again, very crucial. That's where we're going to talk about how GloCyte plays a role in a little bit too. Once again, just to level set, I know most people on this call probably know a lot of this information that I'm covering right now. Cell counts are a critical part of CSF analysis, right? Total white blood cell counts are very, very low in the CSF, right? For neonates, 0 to 30 cells. I have a daughter who's less than a year old, and it's kind of interesting how as we age, it's inversely proportional. As you age, so adult that's 18 years or older, we only expect to see around 0 to 5 cells of white blood cells in our CSF. In RBCs, hopefully none if we have a healthy patient as well. So once again, to reiterate, having the specific number of white blood cells in that level is very important when it comes to analyzing the CSF. I was talking with a neurologist last week at UCSF, and she said, the difference between 3 to 10 cells when it comes to total CSF counts is huge. And as a neurologist, I'm looking at the course of action based on that specific threshold count. And that's why, right? Because we expect the normal patient to have around 0 to 5 cells. That's an adult as well. So just once again, reiterating just the threshold number of cells, white blood cells and red blood cells in the CSF and what we see at normal levels. Okay, let's talk now kind of the meat of this presentation and why we're here today, right? What in a lot of the hospitals that we're probably in right now, you're using some of these methods. What's the pitfalls of the methods you're using, and how can the GloCyte help you here? I always like to do this activity because, and you're going to see it's a little kooky, but it's going to illustrate a point in a second, right? This dress was viral a few years ago. In the chat, if you feel comfortable, I want everyone to take a look at this dress. What do you think the color of this dress is? I'm gonna give everyone a couple seconds to do that. Throw it in the chat. I promise no one here bites. I may judge you if you choose the wrong color. I think there's a right color here, but also, everyone's different when it comes to this answer. So I see some blue and blacks. I see some white and golds. I see some white and golds. All right. For those of you that say white and gold, I said white and gold. She sees white and gold. It's the trick here. The actual color of the dress is blue and black. But depending on the specific. I think I lost everyone for a second. Hopefully everyone could hear me again. The point I was trying to make is it is very subjective, right? So we're going to kind of go over the manual method and that ultimately being subjective as well. So let's get into this, right? So traditionally, and I'm sure what most of you are used to when you're analyzing, a CSF count, is this manual Hemocytometer method. Now, I'm not going to outline all the separate steps of this, but this process is relatively tedious. It's a very long workflow. It requires, step-by-step demand from the operator of the actual of the clinician that's ultimately doing this test, right? So, and on average, this can take around 30, if you're someone like me who's a little bit on the slower end, 30 to 45 minutes. And in a clinical lab, when time is of the essence, these are stat samples. This is not the only thing that you're running today. This could be the deciding point between that 3 to 10 cell count ultimately, right? So this manual method can be relatively subjective dependent on the technician, the clinician who's ultimately reading this step. And it's relatively time consuming as well. Like I said, on average, just speaking to a lot of hospitals, this process takes anywhere from 30 to 40 minutes. So the manual method, which most hospitals use at this point, has its pitfalls ultimately. The other thing which I hear a lot as well is we have these great automated cell counters. And I don't want to talk anything bad about these cell counters in general, but some people try to use these for CSF as well, and especially low levels of CSF. So these cell counters are really, really good at highly cellular body fluids, but they're relatively bad at low cell counts. And we have, and some of you may have some of these systems in your specific labs, right? But we have these different instruments that kind of show you the thresholds of where the sensitivities of these systems lie. The beauty of GloCyte is we can go really, really low, down to 0 cells per microliter, but for both RBC and white blood cells. So it's one of those things where if you have those clear and colorless, or you have those red blood cell counts that you need to get really low, the GloCyte is bar none the leader in this specific field. There's always going to be limitations when it comes to these automated cell counters and the sensitivity that they ultimately claim they can actually get. So both methods, these are commonly used within the clinical setting right now. And what I want to show you, and Jordan's about to show you, there is a new, better way to do it. So without further ado, so that way you don't have to listen to me drown on anymore, Jordan's going to kind of walk you through in our test lab of how the GloCyte gets run with a CSF sample. Then your guys are going to come back to me and we're going to do a couple case studies, and then we're going to open up for questions. So go for it, Jordan.
Hello, everyone. I hope I pinned myself so I'm bigger for all of you to see the demonstration. But good morning, good afternoon. Maybe you have to stop sharing your screen, Nick, so it gets bigger. Maybe? Does that work? Okay.
Done.
All right, here we go. So as you can see, we're jumping right into the live demo now. You can see the GloCyte is really small. This is the size of a Keurig coffee maker, basically. And it's really robust, and it's actually a simple design as well. If you open this up, which I know you're not going to be able to see it, but inside here is just a microscope and a light source. That is all that is there with the GloCyte. It was designed to be really robust and simple. And right here next to it is the vacuum station. I'll go over that in a second. I also have right next to me is the sample preparation tray. So you'll see here, I have my controls over here. I have the high and the low. You're going to want to run those every 24 hours. And these want to be stored between 2 and 8 degrees Celsius. And once those are open, they have a shelf life of 30 days. Going over to the other reagents that we have here, we have the red blood cell reagent. Not sure if you can see that. This is an antibody stain, so it stains onto the red blood cell. This one over here is the white blood cell. This one is the TNC reagent. This one's actually really unique. It lyses onto the cell to get into the nucleus and stain the nucleus of the white blood cell. And right here, I have my sample. Don't worry, this is just a sample from the lab. I did not stick Nick with a 4-inch needle to perform this demo today. I promise it is all for just a demonstration. But let's jump into it. So what I'm going to do is I'm going to take 30 microliters. I'm going to pipette that into the aliquot container that I have in front of me. For both of these, so I can test the red and the white. And I'm going to pipette 30 microliters of our red blood cell reagent. In and mix this 3 times. And I'm going to let this one sit. This one needs to incubate for approximately 3 minutes. Don't really want to go over 15 minutes, but your lab gets busy, so you'll see how quick this runs. But I can automatically, go right into the white blood cell and pipette that right onto our test cartridge. I'll do the same thing. We're going to mix it 3 times. Get that onto our test cartridge. And this test cartridge is actually really cool. So it has a membrane on the top. I will show you how that works. So I'm going to bring you over to the vacuum station. And what's going to happen in the vacuum station, I'm going to set it off here. And you'll see all the sample on the top. But the vacuum station is going to suck that down. So all the cells remain on top of the membrane for the GloCyte to be able to test. I'm going to press this really fun button for approximately 10 seconds. You'll see the sample go right down through. And then you'll know it's ready to get popped right into the GloCyte. Now I'm going to show you our software. So you'll see our software is really intuitive. It's basic to run. There's not a lot of buttons. Not really hard to mess up. But you'll see over here in the corner, you have patient and you have check. Check is the quality control check, but we're running a patient sample. So I'm going to click that. I'm going to type in demo, and I'm doing the TNC result, so the white reagent, and white blood cell reagent, excuse me, and solution. I didn't run a solution. You saw me prepare it, so I'm going to click none. So also for appearance, I have clear, cloudy, and bloody. So some people always ask is the GloCyte able to run a bloody sample? And yes, it is really robust. It can run a bloody sample, and if it's too numerous to count, it'll tell you. So we have my healthy patient here, so I'm going to click clear. And then also color. Nick went into this. The GloCyte has the ability to test all these different colors. But again, we have a healthy patient, so I'm doing colorless. Nick also went over today the different tube types. So this is really what your SOP states. So we're going to do 3 because that's what we normally see, but whatever your SOP says, that's what you're going to want to do. And then I'm going to hit start test. And within seconds, your sample is going to be read. So the TMZ result for this is 46 cells per microliter. I'm going to click yes. And while I was going on and on about that, my other sample is ready. So I'm going to come over here, do the same thing that I did before. I'm going to take 30 microliters of my sample. I put it into our test cartridge. Get over to the vacuum station, press my favorite button ever. Watch the sample go down. Get rid of this other sample that I have here. Pop this into the GloCyte. Bring you back over to the software. Repeat the same process. So patient, putting in my accession number. Now I'm doing the red blood cell. Dilution. I promise I will go over the dilution. I told you I would. Appearance, clear, colorless, 2, 3, and start. And again, within seconds, it's going to pop up the result. So this is 47 cells per microliter for the red blood cell reagent with the CSF. So I'm going to click yes. So let's get into dilution. How would you know if you need dilution? You just prepared it. Don't have to worry about that. The GloCyte will tell you. So say I have no dilution, but say I have a bloody sample. It has a red color to it. Still came from 2, 3. This poor patient, I feel so bad. And the GloCyte's like, whoa. What? This is too numerous to count. I'm not going to be able to count this. Do you want to retest with a low volume? And you say, sure, but how do I do that? No need to worry. The GloCyte will actually tell you the actual dilution that it's going to need. So it says here, I'll put 10 microliters of your already mixed sample and reagent into a new test cartridge. So let me demonstrate that for you. Come back over here. This is my favorite because you don't have to take the sample again. You don't have to grab more reagent. All you have to do is pipette a tiny amount, 10 microliters, onto the test cartridge. I have a fantastic excuse to use my favorite button again. Fire the sample out. It in. Bring it back to the software and hit OK. And then another unique thing about the GloCyte, you don't have to go back in and retype in the accession number, put the dilution amount that you had. You can just hit start test. The GloCyte knows what you just did. So you hit start test. And within seconds, yet again, you have 116 cells per microliter. It could read it for you. So I'm going to click yes. And that is how simple the GloCyte is. And you can see down here in the bottom, it tracks all your results for you as well. So not only does it have the accession, all the things that you typed in, but it even stores date and time, user ID, and all the other information that you put in. You can even put in comments as well. And I'm going to click results. Audit table, you can see all of the previous tests that we have run. And you can see it's a lot. But all of these samples get stored, all of these results get stored. And that is how simple the GloCyte is. But I'm going to pass it back over to Nick. Thank you. I hope you enjoyed, but Nick has a couple more slides for you.
Great. Thank you, Jordan. And I know, sorry, guys, I think that the mic that Jordan was using kind of cut out a little bit. Thank you, Jordan. That was wonderful. I could hear you a little choppy, but just to kind of reiterate Jordan's whole demo here, you saw really, and hopefully you could see this just through the video, just how quick it is. She did all of one patient sample in less than 5 minutes. Think of how impactful that is. I just told you, even the best tech that's sitting in a hospital lab, probably this whole process takes them around 30 minutes. Now, if, like I said, someone like me who's a little bit slower can take upwards of 45 minutes. The beauty of the GloCyte is as well, It's automated. It takes all the guesswork out of everything. So you don't have to worry about, okay, did Jordan count 3 cells? Did Nick count 10 cells? Did Julie count 5 cells? It really is accurate and ultimately precise. And then also sample volume. These CSFs are you know, we don't want to have to stick someone again and do another spinal tap. We only need 30 microliters for each of our ultimately stains. So it's really a quick, easy process. And the last thing that I just want to reiterate that Jordan shows is that dilution process. I talk with hospital labs all the time, especially with CSS. The dilution process is ultimately the hardest part. You have to try to figure out, okay, I have a really bloody sample. Is that a 1 to 100 dilution? Is it 1 to 10? What do I do? And different techs are different, right? The GloCyte will look at those results and take the guesswork out and recommend this correct dilution to use. And once again, streamline that process. So real quick, I have a couple more slides that I wanted to run through and really just talk about the challenge of clinical laboratories in general. And this study was done in the US, right? I think what we've seen you guys have probably seen this in your labs, is there's really increased demand for lab tests that's just driven by populational growth and aging societies. And there continues to be a shortage in clinical lab scientists, med techs, and just everyone in the clinical setting, right? So what does that result in? Increased wait times because patients' results take longer to get, right? And increased lab pressure, right? I'm sure everyone on this call is scrutinized on a daily basis and has so much work that it's hard to really focus on doing the best and getting the best results out, you know, in a timely fashion ultimately. And that's where GloCyte can help. And I have 3 case studies, if you'll indulge me real quick, that I want to go over that will just highlight really the 3 main areas that GloCyte can just provide value to your lab and your hospital. The first case studies that we did was with Mercy One. They're located in Des Moines. They implemented GloCyte. It's a 600-bed hospital. They saved, on average, 122 to 228 hours a year just implementing GloCyte, right? The physicians, they kept hounding the lab because the turnaround times for their cell counts were just so slow compared to what they needed to get the diagnosis quicker, that they brought in the GloCyte, and we did the study with them. And that's pretty significant. That 122 hours to 228 hours, that's time that you could be doing other things, focusing on other labs, having a better quality of work ultimately. So that's super big when it comes to time savings. I told you earlier, we're talking 5 minutes versus 30 minutes. It's crazy when you think about the time savings that GloCyte could ultimately help your lab with. Next. And I have another slide at the very end, but we did a blind study with another hospital where we just did a correlation study between the manual cell counts versus the GloCyte. And ultimately, the GloCyte was way closer to the expected value of the average cell counts compared to the manual setting. We saw a lot of biases when it actually came to the manual results. So what happened with this specific hospital is their lab techs just really felt better with the results that were coming out. They didn't feel the stress to get their cell counts ultimately right because they had the GloCyte, which streamlined everything. I have another example at the very end of this presentation that will walk through the data a little bit more with another hospital that we use. But once again, it's crazy to see the difference in accuracy between the manual cell counts and the automated GloCyte here as well. And then lastly, with Boston Children, they implemented the GloCyte, and what they realized, and it's funny, actually just spoke with these guys a couple weeks ago. Their lab techs just feel so much better once they get these samples in. They're stat samples. They're not as stressed anymore. They have a standardized workflow when it comes to the GloCyte where it just takes the guesswork out of everything, and it makes them just feel like a lot more at ease when it comes to these CSF samples that come in. So really, it came back to lab satisfaction and really decreased stress levels. I know that's hard to measure, but in this case, you know, really they speak glowingly of the GloCyte and continue to use it, you know, on a everyday basis when it comes to all CSF samples that come to their lab. Now, lastly, and I just told you guys about the blind study. We actually did a study last year with Loyola University Medical Center, where we did a correlation study between the GloCyte and the manual cell counts as well. And what you can see when it came to the dilution factors, the GloCyte by far showed way less biasy, and it showed way closer to the expected amount of TNCs compared to the manual methods that Loyola used to use before implementing the actual GloCyte. All right, that was a lot of time in a little, that was a lot of information in a little bit of time. Questions, and I already see we have someone in the chat that asked a question. Beautiful. Thank you, Karina. Is the GloCyte instrument manufactured in the US? Yes, it is. So our headquarters are based out of Norwood, Massachusetts. That's where we manufacture the GloCyte. Do we have Canadian offices? Not at this time, but we do have Canadian customers. So it wouldn't be super hard to get you a GloCyte if you're located in Canada. And where do the consumables come from? Both the consumables and the equipment, both manufactured in the U.S. In our Norwood facility as well. Now, I know it's a little tricky with tariffs, but we can help navigate that as well. So if geography is the rate limiting step, we're here to help you. Other questions, concerns? Are you just tired of hearing me talk? Great question, Nicole. Yep. Nicole asked, can it be connected to LIS? Easily. It's easily integratable with your LIS system. Other questions? Great question, Nicole. Sorry if we didn't cover that. Yes, totally. We made this for ease of use. So we wanted to make sure that, everything that you guys would do in your normal function for anything automatically fits in with the GloCyte and its workflow. Other questions, concerns? All right. If not, please. Is there an AMR? Great question. This is, I'm going to actually, Julie Maria on the call. Do we have an AMR for the GloCyte? Maybe this is just a...
Yes, so the analytical measuring range, we can take a snippet from our user guide, but goes from 2 and 3 cells per microliter, and will get you the top end of the range. I believe it is around 5,000 TNCs per microliter, or sorry, WCs per microliter, and much higher for the red cells, but we can get that information and circulate it.
Definitely. Thank you, Julie. I appreciate it. That's what I was going to do as well. We could definitely follow up with you, Nicole, and get you the AMR for it. Michelle, is there any expansion to other fluid types? Currently, we're exploring everything, so the more feedback we get, the better. But at this specific moment, we only can do CSF fluid. All right, and I know we're running up against time. What is the required maintenance? Great question, Michelle. Actually, that cool vacuum that Jordan has on our screen right now, there is a O-ring in that vacuum, which we recommend changing every 6 months. Other than that, we recommend an annual PM of the GloCyte, but the system is very, very robust. So besides an annual PM and changing out that O-ring, that's really all that we require as far as maintenance ultimately goes. They're
Nick,
very
I just
robust
dropped
system.
that into the chat for everyone. So the detection capability, the reportable range, as well as the AMR. Let us know if you have any questions. No problem.
I know we're at time and I want to be respectful. Thank you everyone for coming. I know 30 minutes out of your busy schedules is a lot of time, so we really appreciate it. If you have any questions at all, we are here to answer anything. As you can see, I have Julie on the team. Maria is one of our account managers who's on this call as well. We'd be more than happy to follow up with you, provide on-site demo, have another call to discuss the GloCyte more. But we want to really, again, thank you for your time and your patience with us through the call. Thank you, everyone. Have a great rest of your day.